Thank you, Mr. President. Rise today because in a practical place like the state of Indiana, believe it or not, we actually balance our budgets every year. We have common sense things in place that if you're going to receive some benefits of some sort, maybe you do something where we can help to get you to where you do not need the benefits. In this case, this is again something that was not broken and is now being fixed in a way that takes enterprising states like the state of Indiana, like Texas, like Arizona, places that wanted the ability in administering their share of Medicaid to have ways to try to get folks into a position to where they could get back on their feet, seek work, and do things that would make sense for trying to maybe earn your way into that benefit somewhat. Do we believe Washington has all the answers? I think that's what you believe when you get rid of something that was working in many places. I'm in the camp that as much as I know, the federal government has to weigh in and do things, but if the argument is that we've been knocking it out of the park here, we've been getting things done that really work, if it wasn't done in the context that of every dollar we spend here, we borrow 23 cents, and in the time I've been here, 2.5 years, have been probably the loudest voice on trying to fix health care. Part of that issue is in my own party, where I think we're apologists for a broken health care industry. Other side of the aisle wants to just spend money to try to fix it without fixing the underlying issues that drive so many of the problems in this country, where we deal with them in a sustainable way in our state governments, in our local governments. If we take away that flexibility, then we're defaulting to a system that has not been solving the problems. Today, we're here specifically talking about the Medicaid program. The way it works currently, the federal government pays for half the benefits, states pay for half the benefits. Social Security Act authorizes a framework of flexibility. So enterprising, innovative states can maybe do something to bring down the costs of these programs and wean us off the need for them primarily in the long run. Since President Biden has taken office, several state waivers that were previously approved under the Trump administration have been revoked. It's happened in Texas, it's happened in Arkansas, it's happened in Arizona, and now they're coming after a place like Indiana that has got a system that works so well that we are even in the process of giving some revenues back to our citizens this coming year. Where revenues were so far above forecast, we're still taking care of issues at the state level and doing what we ought to be considering, returning resources to the taxpayer. This isn't even that. This is trying to retain the flexibility where it's been working, called the Gateway to Work program, and it's not like it's overbearing. It just requires 20 hours per month of work, job searching, school, or community service. And it was designed in a way that engages the individual needing the benefit that can improve their quality of life over the long run. It's had a long history. The pilot was first approved by CMS in 2007. It's been renewed as recently as 2018. And yet the Biden administration right now, by taking these actions, these flexibilities would have been in place until 2025. It's stopping prematurely what I think is essential if we're going to ever live within our means here, of finding better ways to do it, more sustainable ways to pay for it. We should have that flexibility. With this in mind, I will introduce the Let States Set Medicaid Requirements Act. This legislation will empower states to have the flexibility that they have had, that has been making progress. It will encourage behaviors that will improve health care outcomes, and it has precedence in other federal programs when it comes to earning unemployment benefits or food assistance. This bill is common sense policy that I think needs to be put into place so that flexibility cannot arbitrarily be taken away. Yield to my colleague.
Senator from Texas.
Mr. President, for everything from emergency room visits to mental health care, Medicaid funding is vital to the health of our most vulnerable citizens. More than 4 million of my constituents, including half of all children in the state, depend on the stability of the state's Medicaid program. Unfortunately, the Biden administration has put the health care of these individuals in jeopardy by rescinding a previous approval of Texas's 1115 waiver extension. Basically, that waiver would allow the state to manage the program in a way that maximizes the benefit and save money where possible, mainly through managed care. Now, those are some pretty bureaucratic terms, the 1115 waiver, but here's the short of it. Texas stands to lose $11 billion to provide health care for underserved patients as a result of this unilateral and unjustified rescission by the Biden administration. All this was done for an unconstitutional purpose, to force Texas to accept the Affordable Care Act's Medicaid expansion, something the Supreme Court of the United States has said they cannot constitutionally force. Two anonymous federal officials in a Washington Post story reported as much in a recent story. I said that earlier when this happened to Texas, that if the administration can do it to Texas, they can do it to anyone, any state in this chamber. My friend Senator Braun's home state of Indiana and Senator Young's state of Indiana now is the latest victim, and I appreciate their commitment to ending this game of political chicken. These actions not only unjustifiably jeopardize the health of millions of vulnerable people, they also erode the trust states have when they negotiate with the federal government, where apparently a deal is not a deal. States will never view their federal partners as working in good faith if these agreements are invalidated by a successor administration. If we don't stand up against these reckless actions now, which state will be next? It may not be a Medicaid 1115 extension. It may be some other policy by the Biden administration. But how far, in this case, will the administration go to commandeer state resources into forcing a Medicaid expansion? I'm proud to stand alongside of Senators Braun and Senator Young in the fight to protect the health care of the most vulnerable Americans in my state and across the country. I'd yield to the junior senator from Indiana. I beg your pardon, Mr. President, maybe the senior senator, or never mind.
I think
Senator from Indiana.
I thank my colleague very much for his reflections on what's really at stake here, Mr. President. Last month, the Biden administration's Center for Medicare and Medicaid Services notified the state of Indiana that it was withdrawing approval of the state's Gateway to Work program. So what does this actually mean to rank and file Hoosiers? Well, it means that the Center for Medicare and Medicaid Services has decided to revoke Indiana's ability to determine appropriate work requirements and appropriate community engagement expectations for Medicaid recipients in our state. It means that this administration regards work as some form of punishment, and efforts to transition to a position of self-reliance are somehow inappropriate. Now, we Republicans, we believe in people. We believe in people. We believe in self-reliance. We believe that the vast majority of Americans of modest means, don't want to be trapped in government programs. Medicaid should ideally be a service, which is a temporary support for people who really need it. The goal should be to prepare individuals for a life of dignity, and that includes securing a vocation, finding a measure of self-reliance in life. Now, Indiana wasn't the only state to receive this bad news. Arizona officials also received word that their Medicaid work expectations were being revoked. And just a few months ago, this administration likewise pulled all work expectations from the states of Arkansas, New Hampshire, Michigan, and Wisconsin. Indiana's Gateway to Work program, again, revoked by CMS, would have merely asked Medicaid recipients to report 20 hours of work or volunteer or school or other activities every month. Now, this is really important. These community engagement activities are designed to improve quality of life, to improve the quality of the recipient's life over the long term, and to help Hoosiers transition from Medicaid to full employment. This is what people want. When we think of the American dream, we think of the ability to go out and start a family and be part of a larger community and to be able to meaningfully participate in a nation's civic life and to secure a vocation. Most would regard the goals of Indiana's Gateway to Work program as commendable. However, according to CMS, this program would result in significant coverage losses and harm to beneficiaries. Harm to beneficiaries. A misleading statement that ignores the extensive list of individuals exempt from this requirement. Students, pregnant women, the medically frail or the incapacitated, those with disabilities, and a bunch of others. Now, luckily for Hoosiers, the state of Indiana had not yet implemented the Gateway to Work program at the time of CMS's notice because of the unique challenges presented by the pandemic, meaning that Medicaid recipients will not face immediate disruption of their benefits. Unfortunately, the same cannot be said for other Americans across the country, and we're here to fight for them. This includes Texas, where the administration's decision to revoke that state's waiver put into jeopardy health care for 4 million Americans. That doesn't sound very compassionate to me. Now, up to this point, Medicaid waivers have allowed the states the ability, the freedom under our federalist system to test new policy approaches within the Medicaid program, allowing them to design and improve their programs in ways that best fit their own populations and maybe serve as models for other states where successes are elicited and proven. But with the Biden administration's recent actions, with their one-size-fits-all mandates and mindset, states will now need to be on guard. CMS may decide to revoke its waiver authority at any given time. So this means any attempt by a state to improve its Medicaid program carries a serious risk of disrupting health care for the program's beneficiaries if that innovation could ultimately be revoked. God forbid we try and improve a government program. But I guess Medicaid's perfect, and we can't find room for improvement. Certainly, we can't rely on the states to come up with improvements. Any improvements that might be made would have to come from Washington, D.C. This is the sort of mindset we seem to be dealing with. Look, for a nation that's always valued quality and innovation in healthcare, for Americans who believe we should empower all of our citizens, and for leaders who believe we have a responsibility to provide the least among us the necessary tools to stand on their own 2 feet, this is an unsustainable situation. So I urge my colleagues to act now and stand up for their state's ability to set their own Medicaid requirements that meet the needs of their own citizens. And with that, I yield to my esteemed colleague from Indiana who's been working very hard on this issue, Senator Braun.
Senator from Indiana.
Mr. President, I ask unanimous consent that the Senate proceed to the immediate consideration of my bill, which is at the desk. Further ask that the bill be considered read a 3rd time and passed, and that the motion to reconsider be considered made and laid upon the table.
Is there objection?
Reserving the right to object.
The senator from Oregon is recognized.
Mr. President, first of all, I want to say about my 2 colleagues, I have very much enjoyed talking health care with the senator from Indiana, the lead sponsor of this. We've had a lot of very productive discussions about the role of health care in America. I strongly support the proposition that the federal government doesn't know all the answers here. Sometimes my friends say I'm the senator from innovation because I'm always trying to promote innovations. That's what Section 1332 is all about. And my colleague, my other colleague from Indiana is a very valued member of the Finance Committee, so I want it understood that I think Indiana senators, there's 100% straight shooters who I enjoy talking health care with. Let me say respectfully why I have a difference of opinion with respect to this issue. My sense is that what my colleagues from Indiana want to do is based on a premise. It comes from the Trump administration, which I think is flawed. The premise is that those on Medicaid really don't want to work. And having run the legal aid program for the elderly before I came to the Senate and was co-director of the Oregon Gray Panthers, I just offer up to my colleagues, and again, it's a good discussion. People have differences of opinion. I think those on Medicaid overwhelmingly would like to be able to work. And that is what the difference of opinion is here. As I understand it, Senator Braun wants states to have the authority to condition access to Medicaid on work. Now, his colleague from Indiana noted some exceptions and the like, which sounds like it is of some value, but the basic proposition is conditioning access to Medicaid on work. And it's been my experience, and I've made a practice of it over the years, having been in public life, to go back and talk to people on Medicaid. I think overwhelmingly they want to work. And it seems to me, as we emerge from the economic effects of the COVID crisis, and my colleague and I are going to work, for example, on unemployment insurance, where I hope again to bring flexibility to the states. For example, my colleague on the Finance Committee knows that we've certainly had a lot of serious technology issues with respect to the unemployment insurance programs of the states. So one of the areas I'll propose as we continue our work this year is the 53 systems should have a uniform baseline. And I think we're going to have good support, Democrats and Republicans, on it. The key feature will be, of course, giving states the flexibility to innovate consistent with having a uniform baseline. So I want my colleagues, both of them, to understand. Senator Braun, who I've had some good conversations with respect to health care, and Senator Young, who is on the Finance Committee, I very much look forward to working with both of them on these health care issues. And for the reasons that I am describing today, I'm objecting at this time, but I think there are a lot of areas where both parties can come together with respect to health care, and for these reasons, I object.
The objection is heard.
Mr. President,
Senator from Indiana.
so my friend from Oregon, we've had a discussion not only on this particular issue, respect his point of view, and I think we both agree, though, that when it comes to health care, it's something that is breaking the bank in this country. When it's 20% of our GDP, and it's 10 to 12% in most other developed countries, it's got to be a problem with the underlying industry and the way government has gone about trying to address it. I'm one in my own business 13 years ago declared that no one should go broke because they get sick or have a bad accident, and then took the tools that were out there with a system that didn't give you many to work with and have found a way to make it sustainable, to put skin in the game for my own employees, to get them to take better care of themselves, and to do things that weren't the same things we've been doing, which have not improved the situation. Medicaid is paid for half by states, half by the federal government. I think it does entitle states to have more flexibility on account of it. But what I would ask my colleagues on my side of the aisle to look at holding the industry more accountable by being competitive, transparent, engaging the healthcare consumer, and at the other side of the aisle doesn't just push through for spending more federal dollars where the proof is in the pudding. Neither approach has been working. It's a tapeworm on the economy. Warren Buffett has got it correct. We need to put our heads together. Thank you, Mr. President.